most of you would have heard the term spondylosis. So it's one of the terms that pops up right on our radar whenever we have any kind of a neck pain or a back pain in an adult or an elderly population. So strictly speaking, spondylosis is a very broad term. It is not like just one disease or one diagnosis. So spondylosis basically refers to a series or a combination of changes that happens in our spine as we age. So these changes can happen in the bone, this can happen in the disc, it can happen in the joints between the two bones. So as a result of all these changes, so naturally, the entire term, the entire gamut comes under the term cervical spondylosis. So it is not just one disease, but it's a disorder which consists of several individual diseases. So what are the patterns, or what do patients with cervical spondylosis have? So basically, as I already told, the most common symptom that anybody presents in the cervical spondylosis is a neck pain, and it can be of a varying severity or a varying pattern. So it can be continuous in some cases, it can be intermittent, only on and off. So only once in a week or once in a month, sometimes people have this neck pain, and virtually with some kind of a physiotherapy or just popping a pill, the neck pain completely disappears in several cases. So this is one of the commonest patterns of presentation, but this is easily manageable as well. But the other two patterns, so the second pattern that the patients can present with is a combination of neck pain and also a symptom related to nerve involvement. So when we say nerve involvement, is that these changes that I described earlier, the spondylosis changes, sometimes can cause some compression or impingement on the nerve root that comes to the arm or the hand. So in these cases, pain usually travels along the distribution of the nerve, and then it causes an arm pain or a hand pain, which can also be associated in some cases with some numbness, and in severe cases with weakness of the hands or weakness of the arm or the shoulder or whichever particular nerve is getting involved. So these are more severe cases which require more urgent intervention in particular in some of these cases. So this is the second pattern. The third pattern is even more serious, so because this involves the main nerve, that is the spinal cord. So as you know, the spinal cord is the one that transmits the nerves all the way from our brain to the hands and to the legs. So when this changes, that is the cervical spondylosis changes, affects and causes compression on the spinal cord, which can be even at one level or at multiple levels. So this results in spinal cord dysfunction. So in these cases, patients usually have a lot of other symptoms as well, like difficulty in walking, numbness or weakness involving the hands and the legs, stiffness in the hands or the legs, which we call it as a myelopathic features. So these are usually progressive, and once these kind of changes or once these kind of spinal cord dysfunction happens, so these are sometimes irreversible, and again these should be prevented in many cases as well. So what are the treatment options for cervical spondylosis? So as mentioned, majority of the cervical spondylosis present only with neck pain, and they do not require any kind of an intervention. So many times they just require regular physiotherapy, and that is one of the most important as well as the most neglected thing that usually patients with cervical spondylosis do. So regular physiotherapy, that is morning and evening, just 5 to 10 minutes of neck exercises that are taught by a physiotherapist can go a long way in preventing these recurring episodes of neck pain or neck stiffness, and can also decrease the incidence of nerve involvement or spinal cord involvement in many of these cases. But yes, these are age-related changes, and as the age progresses, the symptoms or the disease also will progress. So in advanced cases, whenever there is a nerve involvement, whenever there is a weakness or a numbness or a difficulty in walking, so these are the usually cases where surgical intervention will be required. And there are various types of surgical intervention that can be done, either through a conventional open surgery or through a minimally invasive spine surgery, which is more beneficial in terms of faster recovery and lesser blood loss and quicker return to work and all those things. But it can also be done using an approach that is from the front, or also from an approach that is from the back of the neck, as the individual case demands. So these decisions are usually more complex, not within the purview of this talk, and these are the decisions that will be taken by the treating doctor or a spine specialist in individual cases. So most important thing about cervical spondylosis, what we have to understand is that this is a very common condition. It is an inevitable problem. many of the adults, many of the elderly population do have cervical spondylosis. These are natural age-related changes, but as long as the symptoms are kept under control, so nothing major needs to be worried, or these cases do not require or do not end up in a surgical intervention in majority of the cases.